Guys, we're presenting today a dynamic speaking specifically about inflammation. Inflammation is the topic of what we're going to be discussing. As functional medicine specialists, what we do, and we evaluate whether you're an internist, whether you're a physical medicine doctor, whether you're a chiropractor, a physical therapist, a endocrinologist. Part of treating, we try to correlate medicine and try to bring what's best and appropriate for a patient. We do our due diligence in assessing exactly what is the best approach for a patient. Now, the term functional medicine is a new term relative to the last decade or so. It's a practice that basically assesses the entire body to assess the correlations and the kind of associations that are indicative of things that can affect many organ systems, such as how inflammation in today's particular topic matter affects the heart, how inflammation affects the brain, how inflammation affects the gut, how inflammation affects different components of the body. We're going to hear terms, we're going to hear dynamics, and we're going to hear present changes in modern medicine and words that are being used, such as leaky brain, leaky gut. They don't sound like they have a clinical basis, but today modern medicine is really embracing the concept of correlated medicine and personalized medicine. What's good for Billy is not good for Billy's sister sometimes. And even though they may have the same cold, there's reasons for us to adapt their approaches. So what we do in physical medicine is we try to correlate the issues of treating people specifically for pain disorders. At the pain disorders, we have chronic pain, we have acute pain. When we're dealing with functional medicine, what we're doing is we're actually working with the dynamics that assesses where the inflammation comes out and where the genesis is of inflammatory processes. Today's particular topic that we're going to be discussing is inflammation at its basis, because it really is the most important component at chronic or acute inflammation. It's the part of repair and recovery. So today we have a presentation. We have Ana Paola Rodriguez Arciniega, okay, and Kenna Levon. Ana is a master nutritionist, and Kenna Levon is a supreme senior health coach, I call it. And what we do is we're going to be discussing inflammation as it pertains to just a fundamental ideology and an understanding as to what it is. So from there, what we're going to be able to do is we're going to see that these issues affect not only the brain, but they also affect inflammatory repair. They do different components. So they affect the gut, they affect the heart, they affect the intestines. All different components of the body have inflammatory processes. At the basis of inflammation is our immune system, right? So what we're going to be discussing today is how inflammation affects different organ systems. So I'm going to go back and forth between Kenna and Ana, and right now what I'm going to do is I'm going to have Kenna, go ahead and kind of take over the screen so we can start discussing the issues, and she can start discussing how we approach inflammation in our particular practice in physical medicine, in the ideas of pain management and how it connects to different organ systems, right? Because we got to pay attention to the body the way it is. So here we have a presentation, and Kenneth, tell us a little bit about where we're going to take inflammation and immunity. Go ahead.
Yes. So one thing that we do when our patients come into the clinic is we always want to assess inflammation, because it does, like Dr. Jimenez was saying, have so much to do with every other body system that's going on. So one thing we do is called the living matrix. And this is a detailed assessment that really takes us into your history and your story and helps us to kind of put a little bit of a number onto this inflammation and see exactly where we're going. So if we go ahead and look, part of our living matrix, what we get is right here. We can see that it's divided into different categories. This patient right here has a large response to defense and repair, meaning that this is where we're going to want to focus a lot of our attention on at first, to try and go in there and see how this inflammation is impacting their immune response, how we can decrease that inflammation, help rebuild a healthy gut so that these inflammatory responses aren't constantly firing off. and just really get their immune response back down to a healthy level. We want our matrix to look more uniform. We don't really want it to be all over the place. So once we start with our initial assessment and we break down this defense and repair, then we can start to focus our attention on these other areas that the patient may need help with. Another great tool that we have is we have lab testing that we use. And I actually have a sample I'm going to go ahead and pull onto the screen right here. This is from Vibrant America, which is one of the companies that we use. This is their gut zoomer. One thing that I really love about their gut zoomer is you can see right here, not only is it just assessing their intestinal permeability and how that has to do with inflammation, but it also gives us an inside
Can
look.
you just hit the plus mark on there so we can see a little bit better? It's
Yes.
just a little bit too small. Just a little plus mark on the percent sign. Yes. A little bit more. There we go. Now we can read it. Thank you. Go ahead.
Perfect. So one thing that I like is not only are we looking at that intestinal permeability, but we're also seeing how their intestinal permeability is impacting their cardiovascular health, their metabolic health, neurological health, their hormone levels, SIBO, autoimmune health, nutrition. We can just really use this test as a great snapshot along with the matrix on where to focus first in order to really tame that inflammation and help get our patients feeling better quicker, because this takes out a lot of guesswork. Of course, every patient is different and we do use more tests than just this, but this one in particular is super great when we're considering inflammation and our gut health and using it alongside with that matrix and how they coincide with each other.
Kenna, is this the best test, or is this only one of the tests that we use? I can answer that. I'm just
This is only one of the tests that we use. Like I said, it depends per patient on what's going to be the best course of treatment for them and the protocols that we take. But this one really does offer a great overview of everything that's going on inside that gut and really gives us a great baseline to even start with. For later on, we can test our patient again and we can track. Right here, we can track how their levels are going up and down to make sure that that protocol is really working.
What I'd like to mention is that what we look at is you'll see the word gut commensal. Commensal means basically the good bugs, the types of bugs that we have. So in essence, as we look at those particular dynamics, we actually see what's going on. Can you kind of like minimize that particular screen on the report and just bring it down, and so I can go back to the matrix there behind it? The matrix behind it is one of those areas that can actually teach us that in most situations, a individual doesn't just have one area that is really having a problem. You'll see that people have energy issues, they have biotransformation issues, and they also have, vascular issues, neuroendocrine issues, structural integrity issues, and we're going to be discussing even assimilation issues. What we try to do is begin in a direction. So with functional medicine, we can really assess through a detailed questionnaire where the issue is, not just inflammation, but where the disorders seem to be creating the biggest kind of like impact for the individual. Based on this elaborate history, which is pretty profoundly deep, we can actually assess where we want to begin as a starting point. Otherwise, what I get from our patients is that nutritional advice is confusing. As it's confusing, it wraps you around so many times of thought processes from different doctors that you become literally tied up within a spin of a cobweb of also an enigma wrapped around some sort of chaos, at which point you find yourself lost. This is a problem that's affecting most doctors in dealing with a type of practice. So what we try to do is to bring order and clarity in the direction that we're taking this direction. At the basis of today's particular discussion is the immune system. So once we figure out that there is an immune system, Anna is going to be able to take over the screen right now. And as she does, what we're going to be able to see is that in the dynamics of what Anna presents, she's a nutritionist, a master nutritionist, and an educator as well. She teaches and she's taught at different places. She's going to bring us some insights into a little bit about the immunity as well as, or the direction she wants to take this particular commentary at. So do you have access to the screen share, Anna? Yes?
Yes.
Go ahead and pop your screen up, and then what we'll do is we'll take it from there and we can look at it. Now, I know you had mentioned something regarding the immunity and the direction we want to discuss this. Go ahead and tell us on your direction.
Well, as you said before, everything has to come together. So eventually, what we're going to start seeing is that inflammation has a direct response with immunity. And sometimes people come over to us and they say like, oh man, I think I have a food allergy, or I keep having like this infectious disease and I don't know where it's coming. And once I get that flare up of infection disease, I get inflamed and I get bloated. And it seems like my life is coming like it's like falling apart. So sometimes you have to go, well, not sometimes, all of the times you have to go look at the antecedents, look at the triggers, look at the mediators that are the ones that are like the main players, the main factors that are inducing this particular condition, and try to link them together. And most of the time, well, not most of the time, all of the time, inflammation is going to be a big part of it, because it's like the big trigger of everything. We might have the gun, but inflammation is always the trigger. So it's just like the same thing with immunity. It's just that we have to look at the symptoms. Whenever a patient comes over and you see that she or he's having some kind of allergic reaction, or maybe she's having a rash, or maybe he's having bloating problems, okay, go directly to the gut, because right there is where we're going to find the answer. So yes, maybe right now we just can make like the connection. Why is inflammation, or why is the food that I'm eating provoking or being the leading cause of this inflammatory response or this immunity response that I'm having? But you will see after this quick explanation of what is going on. So we have.
Let me kind of interject there. One of the aspects that Anna was mentioning, she was discussing particularly antecedents, triggers, and mediators. To bring clarity to the antecedents, antecedents are things that are predisposing factors. These are things that your genetic, your environment. It could be things that constantly are in your life. They're there. They're the things that maybe. You live in an area where there's high electric, high toxins. These are your antecedents, your environment. Also, antecedents has a lot to do with your genetics. So when you look at someone's genetics, these are the predisposing factors. You know, the number one thing that determines your fate in life is genetics. I have black hair. I have a certain type. Those are the things that determine are determined by my genetics. So whether we have that, we see that we are being influenced greatly by our genetic predisposition. What we're learning in modern medicine is that your genetics are what we use as an example of like a gun versus a gun is the thing that you can have in your house. That's your genetics, okay? Whether you choose to trigger it and fire it, it's up to you, okay? And in many situations, we do have the ability to mitigate and to work the triggering factors. So when she was mentioning antecedents triggering, the trigger is what activates those antecedent environments. Now, sometimes what we have is we have mediators. These are things like stress. We're learning that these are things that continue the problem, things of constant foods. These are the certain allergens and certain things that cause inflammation. These are the mediator that kind of just keep it going. It's like when you start a balloon and you just start it, that's the trigger. It goes up, but everybody keeping the balloon up, keeping it going through the party, those are the mediators, right? So we need to figure out what those mediator components are. So I just wanted to explain exactly what antecedents, triggers, and mediators work. Go ahead, Anna.
Yeah, so that's right. And sometimes we ask the patient like, okay, did you have or do you have any like sibling who has previously reported allergic reactions to food? Well, that would be like an antecedent that you might want to look at. Or maybe, hey, what was the type of birthing that you were put into the world or something like that, that would be an antecedent. A very powerful antecedent is your birth and weight. And another thing could be like breastfeeding. It's very important antecedent for us to know. So, well, that is actually like some antecedents that could be linked to this kind of problems. Specifically, if we're talking about immunity and nutrition and allergies and food sensitivity. So, well, let's going to digress a little bit, and we're going to talk about what is exactly what makes a healthy immunity. So we have like this fun word play right here that it's dirt. So what it's going to be like the main parts, or like the main protectors of immunity, or what it's going to be like the protective effect of immunity. Well, it has to detect and defend every kind of a stranger pathogen, or not like a stranger pathogen, just like a stranger microbe that we might be having in our system. Okay, there is like this funny microbe looking guy. It's right there, but I'm gonna keep it right there. I'm just gonna keep it at bay. Okay, it is detecting the microbe, and that's like the thing that it's doing right there. The other thing that a healthy immunity might be able to do is that it has to be internally regulated. Once it fights this funky looking microbe, it's going to be like capable of cleaning up the mess. So this is how I understand it. I always kind of try to think about it as if it was a story. So yeah, internally regulated. They might want to clean up the mess that they made while they were like fighting against this microbe. Another thing is that it is restorative. It has to come back after a fight. So yes, that's like the art of this wordplay that we have around here. And tolerant. It has to be able to tolerate that there's like this funny looking pathogen or microbe, but since it's not doing anything, I'm not going to attack it, because if I attack it, I might produce some kind of cellular debris that will cause like a more reactive action right there, and I don't want to do that. So I'm going to tolerate that microbe that it's right there, and I'm just going to let it be. So that's essentially what immunity has to do. It has to be very diligent. It has to be able to work whenever it is activated, and it has to be able to know what it's going to do. Like to not react if it's like not like a problematic microbe that we might have in our organism. So as I said before, the immune system should be able to identify any like threatening structures that might be getting inside of our system. And something very important is that it has to recognize the stranger signals, but this doesn't mean that it has to be like all reactive all the time. Like, okay, I get it. It just went inside of the body, but it's okay. I just detected. It's right on. We're going to live with it. And the other thing is that it has to be prepared to respond to the threat in an appropriate level when the danger is present. So if it's not like a very like life-threatening situation, the immune system might want to like keep it like in the download right there. Mm-hmm. So that's like the deep part of the dirt.
Anna, can you go back to the first part of that I was looking at, and that was actually the right before that one, that screen right there. Yes. Detect. It's a great little kind of like a good wordplay, as you call it. Yes. Detect, defend. We have had situations when we try to be a little bit smarter than the immune system, and the immune system has to be pretty much all these areas. It has to detect, as you indicated, detect and defend. You know what? I was given an example of for those who have cats. Their cats are always kind of like they're just sitting there quiet. But if there's something that moves and small, they attack. They're sentries. Okay, that's the part of what they call the innate immune system, that it kind of sits waiting, kind of looking around, just evaluating, looking things and making sure that it can do things. It's ready to pounce on things. If it goes too crazy and it becomes more than internally regulated, it may go internal deregulated. In other words, it goes crazy. And for that, we have disorders where the immune system does not regulate itself and keeps on going and going and going and doesn't stop. We have caused, from chronic pain syndromes to autoimmune disorders. And we end up seeing them in the office where the internal regulation systems are going to kind of continuously array. Restorative, it has to be able to repair. It is the first guys it's almost like when you have an electrical fire in your office, and then you got these electricians show up right away. They're the first to come in. We got to fix things up. We got to scrub it up and we got to make it work. So it has to be restorative. It has to be tolerant, because it has to know, as you indicated, from what I'm gathering here, is that it's got to be okay with certain things, lets things pass, and certain things doesn't, right? Mm-hmm. So let me give you an example of one where it's internally regulated and restorative. Now, many years ago, we had certain medications that were COX-2 inhibitors. COX-2 inhibitors are inflammatories, and we don't have to go into the names of those medications. But what we learned is that those medications worked so well on preventing the immune system from function that the actual restorative component of the immune system was blocked. Well, what happens is your body decays. And one of the symptoms is cracking of the skin issues, skin repair problems as a result of trying to kind of pigeonholed the immune system. So it's very important that we are able to understand what the immune system is and how it affects the various different organ systems. Anna and Kenna were discussing how it relates to different components. And what we need to see how we can, as physicians, assess where we can assist the immune system and we can help regulate it. Now, I know you're going to go over some additional things. Go ahead and continue with that.
Well, thank you so much. I think we already talked about being internally regulated. It has to be very tightly controlled, as you said before, not to overreact over a single little thing. So it has to keep its cool down. So yeah. It's gonna be like a cool guy that you
no drama.
Yeah, no drama in my house. It's like I know what is going on. I have it under control. I will keep it tightly controlled, and that it's me, the immune system. He's like a cool guy. So whenever it's controlled. So restorative, it's going to be able to repair the damage. So most of the times when the immune system responds, it's going to cause some kind of cellular debris, because most of the times the pathogens get disintegrated, and that same degranulation might cause a very inflammatory reaction, or this particular these little particles might get inside of our gut system or our lymphoid system, and eventually the reaction is going to be bigger if it goes that way. So as I said before, the immune system has to make sure that he cleans up his own mess. So it's a very cool guy, and it's a very clean guy. And it has to be tolerant, as you said before. There are going to be good guys and bad guys. I mean, he has to be able to recognize that most of the guys that are going inside of our system are not bad guys. If they are microbes that might be able to colonize our gut, and they are good for us, then he might want to tolerate them inside of our gut. And I think that leads us exactly to the part of the immunity where our defense against pathogens, or the barriers that come with the immune system, play a very important role right here. So I think that the body is so interesting, and it's so intelligent that it gave a special place for all of the lymphoid system and all of the barriers to be exactly where they want to be, and to be exactly where they need to be in order for them to protect us from any pathogen that's going to be like roaming around our house or around our food, or just like a pathogen laying around there. So yeah, what is like who are the guys that keep like the pathogens at bay? Well, it's going to be the physical barriers. As I said before, it's going to be the skin. The skin is one of the most important parts of the immunology, of the immune system right here, the mucus and the saliva. So I would like to really like link them together and say that mucosal barriers are like the most important things. And one thing about mucosa is that it's going to be the place where our microbiome is going to be present. So I would like to make like that association right there. The mucosal system, the skin and the saliva, it's going to be like filled with microbes. They could be either good microbes or bad microbes, and that's exactly where the testing and the live-in matrix and all of the test don't guess part of the functional medicine approach is going to be like a very important factor right there, because we don't want to get rid of every little single microbe in our system or in our gut or in our mouth. They need to stay there in order for protection to be better. Let's put it that way. So another thing that it's like very important is the cilia. For example, the cilia could be easily found in our nose, and it can brush out like the pathogens outside of our nostrils. The acidic pH. So this is like very important, especially when we're talking about the gut. I recently had like this patient that came to me, and she was like having like this like bloating problem, and she just didn't know why. And I started asking her like, okay, tell me a little bit more about your medication history. And she told me that she was on anti-reflux medication for around 5 to 7 years that she wasn't sure about. So man, she was like suffering from a very extreme SIBO, and it was just because she wasn't producing enough or sufficient acid, like gastric acid, in order for the food to be like ready to be digested and absorbed. And she was like having that reaction. So yeah, pH and the gastric acid and the acid environment that has to be inside of our upper intestine, like the small intestine, is really important for our bacteria to be in symbiosis with us. So that is very important.
Anna, you mentioned certain areas when you were discussing things. I'm going to go ahead and take the screen for a second there. The idea behind the immune system, the way that God designs it, is can you see my screen there already? Yes.
Yes.
What you see here is that you see that there's areas of the immune system and barrier system. So the way that God designed us is from when at the first moment that a antigen or antibody or say a reaction or a reactant, or let's say an antigen, enters the body, it is first met with your adenoid tissue. This is the NALT, okay, the nasal, immune system, okay. This over here ends up with your BALT system, okay, which is your lower respiratory, your brachial or your bronchial immune system, okay. As it goes into your skin, it's the SALT system with skin as the S. The GALT is what she was indicating, which is the gut, is in your immune system. The VALT is vaginal areas and urogenital region, where this also protects you. So the designer really intended for us to be able to be protected in many ways, and we are able to see those things. So when we look at this kind of dynamics, you can actually see that the body is well protected. However, what we're going to be discussing is the inflammatory reactions as they occur in the body and how they affect the body. And we're going to continue to do it in future podcasts as well. So what we want to do is, Anna, you can take over the screen there, or you can go ahead and run your program. I just wanted to make sure I create clarity in terms of the types and the areas of where your skin, your intestines, your pulmonary system, your not only your nasal area and even your genital areas actually affect your ability to protect yourself.
Yes, sure. That was very insightful. And of course, as you said before, the one who designed us knew exactly where to put like very special things in order for us to be protected. And another thing that I would like to mention is that enzymes, the protective enzymes that we have, like lysozyme in the tears, that we know that they are like antimicrobial. So, and they are, this lysozyme enzyme could be actually found in maternal milk. And it's like the most important enzyme after the 6-month period of, it actually goes up after the 6-month period of breastfeeding. So it's one of the most like highly active enzymes that could protect a baby. So another thing that I like to mention, and I really would like to associate this with the leaky gut and the permeability kind of theme right here, is that the barrier tissue has memory that could actually help us fight an infection better the next time it appears in our
Anna,
body.
what do you mean by memory? What does that mean, memory? Does it actually remember? Talk to me about that in terms of the memory component of the barrier system. That this is new. This is not something that was, the new studies are revealing that those barriers has memory. So when it identifies this cross-reactant or this antigen, there is an antibody reaction that your lining remembers. So it's crazy. Go ahead.
Yes, they can actually recall the distinct like pathogens that wanted to get through them or that went through them the first time. And it's safe to say that the barriers tissue function or are part of the innate immunity right there. It's like they know they are there to protect, but they are not going to make like any specific information or any specific like antigen in order to fight a new pathogen, but they are going to fight. They're going to do something. They are like the good guys. Immediately after a reaction is done, after the inflammatory response is done, we're going to get an activation of the innate immunity that will in turn lead to adaptive immunity, or will like kind of make like this interaction, and it's going to be like a kind of more specialized reaction. And that same information is going to translate to the barrier, and that is going to be the information that these good guys are going to get or are going to activate when they encountered again. When they are encountered again by the same pathogen that they were before. So now they can fight it. They know how to react. They know how to fight it, and the infection or the inflammation or the injury will be cured a little bit faster this time. So,
you know, when I'm going to take over and just to give you a visual of the innate immune system. The innate immune system, what it does, it actually can identify the dynamics of whatever it is and bring, you know, it to an end. It's amazing to see when we talk about neutrophils, specifically neutrophils and macrophages, the ability to see exactly where that's going. Let me see if I can do this. Can you guys see that screen right there?
yes, I can see
So
it.
you can actually see how the uniqueness is of this particular macrophage. Here we have, you know, a element or in this particular situation, it's anthraxis, Bacillus anthraxis, and it's a very, very deadly type of bacteria. You can see here, but do you see how the macrophage can jump on it and conform to its size? It identifies it and it goes to destroy it. So this is an immune system. This is what I was talking about, the sentry system. So you can actually kind of, if you just kind of think of it, it morphs into a design. So what we look at is the immune response as it occurs. Now, when we look at the immune structure, as you're going through your presentation, tell me a little bit about the physical barriers, because this is new. What you have mentioned to me is a very new component. We've always known that the T cells, the B cells from the humoral system and the innate system have been able to identify things. But you're actually telling me that the actual barrier itself is actually, it remembers the barrier, the wall lining.
Yes, and as you said before, it's like a very new topic right here to discuss. But we have to think about it as I like to think about it as a bed in which all of our beneficial microbes get to lay, and they can live there in a symbiotically kind of way, and that is the part of the microbiome and the barrier structure that very tight structure that they have. They can actually provide a better protection against pathogens. So that is one of the things that I really want to touch base on that. So yeah, that's practically one of the things. But as you said before, it's very new.
In terms of the inflammation, let me ask you this: with your personal experience and what you have seen over the years, what we look for is what affects our patients, right? So let me ask you, in your clinical experience, in terms of your epithelial, your lymphoid tissue, and as you indicated there, your phases of inflammation, tell us a little bit about how your personal experiences with the immune system, how it's affected multiple organ systems.
The most well, I first would like to start with the gastrointestinal tract permeability. I think that is the most important thing, or the thing that I get encountered with the most. And the thing that I noticed is that in very old patients and the kind of work that I do, there have been enough and very important studies that link gut permeability and the stability of the tissues with a very prolonged length of stay, of intra-hospital length of stay. So that is one of the things that I think affect the people the most. The most time that they spend in the hospital is going to be the worst. They're not gonna have any kind of improvement. They're gonna continue losing musculoskeletal mass, and it's going to be it's going to be even harder to fight against infections once they start getting in that kind of metabolic and nutritional state. So I think, and I know that the provision of prebiotics and probiotics and this kind of patients is going to be a big effect on them, and they're gonna get a better outcome out of it. So yes, that's one of the first things that we have to put into that idea. The other thing that I know that actually helps is that immunonutrition, and immunonutrition is one of the promoters of anti-inflammatory pathways that might help reduce that pro-inflammatory response that very ill patients are having. And maybe I'm talking about critically ill patients, but this can actually function in chronically ill patients. And I'm talking about cardiometabolic distress, or I'm talking about allergic reactions. I'm talking about every type of chronic disease. So yes, in that particularly set of things, immunonutrition, it's going to be a big help out of it, but it's going to be because all of the immunonutritional foods are going to induce anti-inflammatory effect, and they are going to repair that tissue that it's going to be distressed by all of the diseases that are inside of the patient. So
Anna, as I go do that, what I like sharing here is that, let me go ahead and share my screen here. Share my screen, and you can actually see that when I look at what goes on when I see a patient, and as we've been able to work with patients, it may start out as an issue that it's a back problem, it's a knee problem, it's a chronic issue. And what we've seen is the inflammatory components don't just stop there at the knees. We're dealing with an individual, and we find out that many times I'm dealing with an individual who's had multiple joint issues, maybe even replacements at an extreme, okay, or just chronic knee pain or chronic discomfort. Well, we are trying to make the connection here that it does rely upon the general state of the immune system and the inflammatory response. So as we look at the way the body responds, it's really, I think, important to be as a clinician, as a group of people that are out here looking at to see what is the correlation to all of a sudden their brain fog. Okay, because now we have a joint problem that a person is also having memory issues. They are sometimes taking, proton pump inhibitors, such as for anti-acid production in the stomach, which now alters their biome, or their what they call their gastric biome, or their bacteria.
Yes.
Affecting directly the immune system. As you look over here, again, in this particular picture, as Kenna had put, you can see that it crosses the line. So we sometimes have to become like almost like scientists to figure out where this correlates, not just to say, okay, this is a joint problem and send them out to, let's say, a joint specialist, or it's a memory problem and a neurologist. We're trying to put it together, and that's what functional medicine it works on. So what Kenna was presenting there, and Kenna, if you want, I want to end today with the component going back to your Vibrant study. Do you have that available there at all? So as you got that, and by the way, Kenna, we're the only podcast in the world that has a 6-month-old.
Yes.
As one of our guests. So you can sometimes hear there, because we're all inclusive here. So we are ready, and my mommy took care of me. She could bring me all the way to Motorola back in the day. So people would look at me and say, Jadita, hey, what's with the little kid? And that was just a nightmare. So she had to bring me to work. Otherwise the house could get torched. So tell us a little bit about what was going on here in terms of the intestinal permeability. Now, as we see this, we see that the gut, or the commensal bacteria, we really are important, again, to end with this very important component. It affects cardiometabolic, or the cardio system, the metabolic system, the irritable bowel system, the liver, the nutrition, the autoimmune. Is there something that you want to add to this, Kenna?
Yes, I was just going to add on to the fact that since we're talking about the immune system, a strong, healthy gut really will help you fight off so many more pathogens that you come in with. When you have something like intestinal permeability and you are exposed to a pathogen, and if you have a leaky gut, then that's just another area that is allowing this pathogen to seep through back into that bloodstream. So we're not going to be able to fight it as well. So, we say here a lot, from the kitchen to the genes. And one thing that we really focus on in the kitchen is making sure our patients have a super strong, healthy gut, so they are able to fight off everything. Well, not everything, but they are able to fight off more things that they come in contact with, because we don't want it leading to other areas of poor health. As you can see, it's connected, as Dr. Jimenez said, that cardiovascular, metabolic, neurological, even your hormones. There's just so much that really comes down to the gut and the environment and our foods that we're eating. And so if we really attack the gut and make sure that we're building it up to be healthy, we will start to see our health improve in other aspects of our life, including inflammation, our immune systems, and things along that line.
It's amazing as we kind of digress here, the magnitude of what the intestines have to do and correlate with all our bodies. Now, it's very logical. Our experience of the world comes through from as a child from our mouths. So it would be very logical that when our God and our Creator created the protective system, that there was going to be a relationship with the outside world and the bacteria within our system. So what we are aware of that's where most chronic disease begins. Chronic disease begins at the mouth. And from dental hygiene to oral hygiene to intestinal balance, we need to start there. And at that point, it is amazing. Once we understand that this is a very correlated and associative issue, we can kind of work towards a causative reason and find out where it is that it's affecting the joints or the brain fog or the cardiopulmonary reaction. Because we don't want to end up in front of a doctor just because we didn't pay attention. We got to know that we really did do something to prepare our body. And today I'm going to leave it there because we're all doing our thing, and we're going to try and make this a little shorter. But I want you to know that we're going to be presenting a deeper insight into the inflammation and immunology because it is the basis of many chronic disorders. Now, we just began with today the innate system. We'll be ending up in the humoral system, and we'll be putting it together over time. And hopefully we will add to the level of understanding that our population can have, because what I believe is that most people need to understand that I want to know when you drive, you kind of look at a speedometer. Today, you got to know what your A1C is at. You got to know what your triglycerides are at. You got to know what your LDLs, your HDLs are. You got to understand your lipid profile. We understand how our metabolic system is. Today, you hear stories of ketones. We're set and we're poised to be able to share with the public that technology has moved. We can actually measure, simple as how many walks you do, what you're eating, what your diet is. And we can measure a lot of things to determine how to keep your optimal health. So I want to thank you guys all. You can stop sharing that, Kenna, so we can all be on the same screen here. And what we can all do is we can do ourselves a good service by connecting the dots. It's important to connect the dots that what you eat may not affect your joints or your inflammatory or your chronic disorder today. However, it may be doing it 3 to 4 or 5 days later where you don't perceive it. You'll notice that people who eat clean diets, their joints stop hurting. Their brain fog goes away. That's why we have a quick fix, and it's called the elimination diet, that we instantly change the way that someone's metabolism is working on what we call antioxidants or reactive oxygen species that are the result of bad metabolism. So again, the immune system is at its core. So we'll be discussing this much more elaborate. I want to thank you guys all, and I want to tell you I appreciate you guys taking the time and being with us for the next one. And I look forward to the next time we can hook up, and I'll maybe this weekend or so. You guys have a blessed day. Thank you, Kenna. Thank you, Anna. And I appreciate you guys.
Bye.
Thank you.